What's up, everybody? Back again. Just had surgery yesterday, the 11th of August. It's been about 24 hours since the surgery was completed. Surprisingly, I feel really good. Um, I went into surgery. Supposed to get called back at 11:30. They were running a little behind. The surgery center was. Actually, ended up getting called back around, I don't know, 2 o'clock. Well, 1 o'clock, and then I think was in pre-op for about an hour. They got everything set and took me into the surgical room. I don't remember much after getting in the bed and getting the anesthesia, and then waking up once the procedure was done. I was in a little bit of pain immediately following the surgery. Nothing major. It was more of an ache than anything. Um, to be honest, I was in probably more pain with the meniscus prior to the surgery. So, they gave a nerve block and some Percocet. So, wasn't too bad. It just, felt a little uncomfortable. 24 hours later, I have really very little discomfort. I am taking the pain medication as prescribed, and yeah, surprisingly, not very much pain at all. I haven't been able to see the actual incision site yet. It's still bandaged up, and won't be able to change that for another day or so. So that'll be the first time I get a chance to see the actual my knee and the incision. It appears to be a little swollen, but it's kind of hard to tell. They sent me home with a knee brace, just to stabilize the knee. I'm supposed to get rid of that here in a couple days, and so yeah, right now, basically just keeping it, straight when I'm up and moving around. I gotta have the brace on. Basically, if I'm sitting around, the instructions to me were to use the continuous passive motion machine and the ice machine that were sent home with me as often as possible. So yeah, 24 hours later, not a lot of issues. Definitely was expecting a lot more pain and discomfort. I don't know if that's the fact that I'm not feeling that is because of the pain medication. The nerve block should have worn off at this point, being that it's been 24 hours later. But so far, really the only discomfort I feel is on the back of my hamstring, where they stripped those hamstring tendons to reconstruct the ACL, to use as the graft for the ACL. So really pleased so far. I start physical therapy on Monday at 11 o'clock. So I've got a few days to still be hobbling around on crutches and with this brace on. The doctor advised once I go to my first physical therapy session, I won't need the brace after that. So yeah, things are moving much differently than I expected. I know it's still a long process and there's going to be a lot of work to do, but was happy to find out I wasn't being braced for as long as I initially thought. Now, having said that, the initial MRI showed the doctor that there was, in addition to the ACL, that there was possibly a torn MCL, there was possibly a tear in the medial meniscus, and tears in the lateral meniscus. The doctor advised after he went into the knee, the MCL looked fine, the medial meniscus was fine. However, of course, the ACL was shot. It was completely severed, and my lateral meniscus rather, was pretty torn up. The words the physician used were shredded. So he had to remove actually 50%. They were going to try to repair the meniscus with sutures, but they said the damage was way too bad to be able to do that. So they had to remove 50% of the meniscus, the lateral meniscus there on my left knee. So that'll actually make the recovery faster. A meniscus repair would require a little more time on the crutches and a lot more time in the brace. So hopefully this will speed things up a little bit. Like I said, I know there's still a long road, still a lot of recovery in strengthening the leg and getting that full range of motion back, and you know, that's what we start Monday. So I'm doing some stuff here at the house on my own, just some pre-op physical therapy stuff that I did, just some leg lifts and things like that. I'm pretty sure that's not going to hurt anything to, you know, with the brace on, perform some leg lifts just to try to get those quad muscles firing. From what I've been told and what I've seen from other posts on YouTube is that the quads typically will start to have problems after the surgery, just because of the type of surgery it is, and the fact that you haven't been able to fully extend your leg. At least I haven't. I haven't been able to fully extend my leg for quite some time. So those quad muscles are starting to, you know, to get smaller and not be as strong. So like I said, just trying to do some of the pre-op exercises that I did prior to the surgery, to try to get some strength back in that quad, or at least keep the little bit of strength that I do have in that quad, and keep those things going. So yeah, so 24 hours, feel great. Surprisingly, very, very little pain, and I'm super glad I went through with the surgery. I was definitely having some anxiety about it, but once I got to the surgery center and got checked in, I was calm, ready to go, and excited to get this done and get back to hopefully somewhere close to 100% here in the next 4, 5, 6 months. So stay posted. I'm planning to do another video probably Monday when I get back from physical therapy, and actually I'll probably do one the day that I remove the bandage, just so I can see the leg and share that with y'all. So stay tuned, and we'll see you in the next video.